How can breathing techniques help during a CF exacerbation? Imagine your lungs fighting to stay clear when mucus builds up and makes breathing harder. During a cystic fibrosis exacerbation, breathing techniques can be powerful tools to help you manage symptoms and keep your lungs healthier. These techniques are part of airway clearance therapies that focus on loosening, mobilizing, and removing thick mucus from the airways. When mucus is cleared effectively, lung function improves, and the risk of infections and lung damage decreases. One of the most common techniques used during exacerbations is the active cycle of breathing technique. It has three main parts that work together. First is breathing control, which involves slow, gentle breaths using the lower chest while keeping the shoulders relaxed. This helps relax the airways, making it easier to breathe and reducing airway resistance. Using pursed lips when exhaling creates back pressure that keeps the airways open longer, helping to push mucus out. Next are chest expansion exercises. These are deep breaths that fill the lungs completely, helping to loosen mucus stuck to the airway walls. Sometimes a brief breath hold of about 3 seconds is added to allow air to reach smaller airways behind mucus plugs. This increases lung volume and encourages airflow to areas where mucus is trapped, making it easier to mobilize and clear. The third part is the forced expiration technique, often called huffing. This involves a controlled, forceful exhalation with an open glottis, which is the part of the throat that controls airflow. Huffing moves mucus from smaller, peripheral airways toward larger central airways where it can be coughed out more easily. Unlike vigorous coughing, huffing avoids collapsing the airways and is less tiring and less likely to cause damage. These three phases are repeated in cycles to maximize mucus clearance. By doing so, they help reduce airway obstruction, improve ventilation, and lower the chance of infection during flare-ups. It's important to remember that no single airway clearance method is best for everyone. The choice depends on personal preference, age, and ability. Many patients find that active cycle of breathing technique is easy to learn and can be done independently. Breathing techniques are often combined with other therapies like positive expiratory pressure devices, oscillatory devices, chest physiotherapy, and exercise to enhance mucus removal. Regular use during exacerbations helps maintain lung function and quality of life by preventing mucus buildup, reducing inflammation, and lowering infection risk. Always work with healthcare professionals to learn and tailor these techniques properly, ensuring they are done safely and effectively. Keep in mind, while breathing techniques are helpful, they do not replace medications like antibiotics or other treatments prescribed during an exacerbation. In summary, breathing techniques support lung health during a CF flare-up by relaxing airways, loosening mucus, and helping clear it out through controlled breathing cycles. This improves airway function and overall respiratory health, making a real difference in managing symptoms and maintaining quality of life.